Welcome to my YouTube channel. Hello everyone. I'll be talking about the present coronavirus that it's like out now. What is coronavirus? Coronavirus is a kind of common virus that causes an infection in the nose, in the sinus, or the upper throat. And coronavirus is a zoonotic virus, and it is called zoonotic because it is transferred from and between animal and people. So that is what the transfer. It transfers between an animal and a person. It is one of the common viruses that causes a fatal fatal deaths. Now, the first case was confirmed in China on the 7th of January 2020, and the spread is gradually accelerating. I'm sure a lot of countries are now on alert now, and a lot of countries are trying to check out the people coming into the country, especially from the airport, the immigrations. They are trying to prevent anybody that has any respiratory diseases to come inside the country. Now, more than 1,000 cases and more than 41 deaths as at 24th of January 2020 has been confirmed in China. And also USA announced their first case. I'm sure a lot of countries have started noticing this coronavirus. As Kenya confirms high surveillance, South Africa is on alert. I'm sure Nigeria too is on alert because the immigration have been working very well to try and prevent that at the airports. Now let's talk about what's a brief description of coronavirus, the symptoms, and what to notice and how to prevent coronavirus. I said earlier that coronavirus is a kind of common viruses that causes an infection in the nose, in the sinuses or upper throats, and some type of this, it also causes serious cold. Like the thing you're going to see the person manifesting is the symptoms that it presents includes running nose, coughing, sore throats, fever. At times the person presents with fever. Most times it might lead to respiratory discomfort or respiratory distresses, and at times it affects the organ and leads to multiple organ dysfunction, and thereby leading to more organ failure. So this is the extent in which this coronavirus can get to, and most times the investigation that is done is a laboratory investigation that confirms the virus, if the person has a virus in the blood. Now, what is the treatment? There is no really known treatment, but most times because it's a viral infection, even using antibiotics might not really work for the infection because it is viral. So most times it is treated symptomatically. So what is done most time is because the support when the patient presents with fever, they treat the fever with analgesic or they treat the fever. Now, treatment also, how do we protect ourselves? How do you protect ourselves? That is actually the main reason I did this video, because a lot of people are scared now. Oh my god, coronavirus is a virus that is out now. I don't want to get this. Now, there are various ways we can prevent this and protect ourselves as individuals. Wash your hands thoroughly, proper hand washing with soap and water. Ensure you wash your hands properly. I'm going to demonstrate how to wash our hands. WHO encourages us to wash our hands using the 7 steps of hand hygiene. Now, let's assume I'm just going to be demonstrating how the soap and water comes off. Now, let's assume you put the soap, you wet your hand, apply the soap, rub your fingers palm to palm, back palm over back palm, fingers interlaced. What this? Your tips of fingers, then thumbs, then wash your wrist and you rinse. That is the 7 steps of hand hygiene. So ensure you wash your hand most time, not just ensure you wash it with soap and water. That's very important. Also cover your mouth and nose properly with a handkerchief. Probably you're outside, make sure you cover your nose when coughing, or cover your nose when you're having a runny nose. Don't sneeze into the whole ear, because it is a respiratory disorder. It's a respiratory virus. It's a respiratory virus. Also, avoid close contacts. Avoid close contacts with anyone showing any symptoms of respiratory illnesses, like coughing and sneezing. Not just when you see someone is sneezing continuously or coughing continuously, the best thing to do at this point is just to avoid getting in contact with the person, or trying to change the direction of your nose or of your face from the person that is coughing, so that it doesn't get to you. And also avoid self-medication at this point. When you notice any symptoms, avoid self-medication. Report to the nearest or closest hospital, so that the appropriate laboratory test to be done on you. Also, health workers. Now let's talk about health workers. Health workers also, let's ensure standard precautions is done. Ensure you perform your standard precautions of face mask, apron or gown, and also wearing our hand gloves, because this is all the things we can use to protect ourselves. And other thing you can do is also ask for travel history of a patient. When a patient presents with coughing and sneezing continuously, ask the patient, have you traveled to any place? Now there are some countries that are at high risk of this coronavirus, so ask the patient if the patient has been in any of this country recently, so that to be able to help us, and we should also try and protect ourselves at this point. So coronavirus is actually a deadly virus, and we should also be at the lookout and try to protect ourselves from it. Thank you for watching this video.